Okay, everyone, thank you so much for joining us today. You have joined North Kansas City Hospital's Heartburn Stop Fanning the Flames. Today, we have Melissa Laycock here to share some of her knowledge and wisdom with us, and I'm very pleased that we can get her. So, Melissa, I'll go ahead and hand it over to you. Oh, I'm so sorry. We are recording this, and you can ask questions in the chat feature or the Q&A. You can ask those at any time during the presentation, but we will be answering them at the end. So with that, Melissa, I'll hand it over to you.
Okay, thank you, Shanna. I appreciate it. Okay, we're going to talk about heartburn today. Let me see, here we go. So who am I? I am a nurse and a nurse practitioner. I currently am the clinical educator for surgical services at North Kansas City Hospital, which means I'm the educator for the GI department, pain management, all the pre-op areas and the recovery units and the pre-surgery clinic. So if you ever have surgery or have a GI procedure, I would be the educator there and I may see you come through. I also have a history of working in the ICU. Back in my first job was here at North Kansas City Hospital in the surgical trauma ICU. And then I did hepatology and liver transplant for 6 years as well. So all of those relate strongly to GI. So the goals of this talk are going to be to discuss what heartburn is and what it isn't, how you know whether you have simple heartburn or something more serious that you need to have evaluated, and what you can do about it. I wanted to make the point that although heartburn seems like a simple topic, it actually can be quite complex. So, and we'll discuss the differences between simple heartburn and more complex heartburn that might need evaluation. All right. Oh, I want to say one thing. I don't have any disclosures. I don't get paid by anybody. I'm not recommending any medications or treatments or procedures or anything. We're just going to do a review. So the presentation will start with talking about heartburn that is associated with normal levels of acid in your esophagus and stomach, which many people don't realize that you can have heartburn and not actually have excessive amounts of acid. Then we'll talk about what is more commonly understood, acid reflux and heartburn associated with that when you are having more acid come from your stomach up into your esophagus than what is ideal. It is causing pain and it can actually cause damage to your esophagus. And then we'll talk about testing that you might have, and then treatments and things that you can do to help the situation. So I'm going to turn my little pointer on here. What is heartburn exactly? So the term heartburn actually only refers to the sensation of pain that happens in the epigastric region, which is just the medical term for essentially above the belly button. And it goes up behind the sternum, which is the medical word for the breastbone. So the term heartburn only refers to the feeling of pain that you have above your belly button, up behind your sternum. So we're going to review real quick a little bit of anatomy. You don't really need to know that much to understand heartburn and those kind of things. But so the esophagus is the tube that takes food from your mouth to your stomach. The stomach is what makes the cells that make acid, and it turns the food into what's called chyme, which is really just the medical term for the liquid that your stomach is, the mostly liquid that your stomach is turning food into so that it can actually be utilized and digested and absorbed by your intestines. So this is the first part of your small intestines, and the stomach basically grinds up the food. And then as it starts to go into the first part of the small intestines, that's where your body actually starts absorbing most of the nutrients from the food. So the GI tract, all the way from your mouth, all the way to your bottom, is essentially a long muscular tube that's divided into different sections. And there's sphincters that divide each section from most of the sections from the other ones. The most important one for us is this one here that goes from your esophagus into your stomach, and it's closed most except for whatever you eat. And it's called the lower esophageal sphincter and it's abbreviated LES by a lot of people. But this sphincter right here is what helps prevent the acid from your stomach from coming up into your esophagus. Let's see. Just like I was saying with the different jobs that the intestines do in the different environments, the esophagus has an acidity level that's pretty much neutral. It's just a little bit more acidic than neutral. And then this first part of your small intestines also has an almost neutral acidity, but your stomach is very acidic, and it has cells in there that produce acid that help break down the food. And this is important because the cells that line your stomach have evolved to handle that level of acidity, but the ones that are in your esophagus are not used to that level of acidity. They are used to a more neutral environment. So if you have that acid coming up into your esophagus on a regular basis, it can cause damage to the cells of your esophagus. Real quick, since we talked about anatomy, I just want to review some testing, because many of the things I'm going to talk about, you wouldn't necessarily know you have them unless you have actually had some testing done. And I'm going to go into these down the line a little bit more in depth. But so an EGD is esophagogastroduodenoscopy. You don't have to remember that. That's just the scope that they put down your throat, into your stomach, and into the first part of your small intestines. It is very much like a colonoscopy that you have put up your bottom to look for polyps or anything like that, colon cancer, only it's a very, very similar tube that goes down your throat, different tube, obviously. pH testing is a tube that's put down through your nose, and there's another way you can do it as well, and I'll explain that in a little bit. But basically, it goes to the end of your esophagus right by the sphincter, and it can stay in there for a period of time and measure the amount of acid over time. So over a day, it can tell whether you're having more or less acid in your esophagus. And then there's a test that's done a little less frequently called manometry. And that test is very similar. It can go down through your nose, but the tube measures the muscle contractions of the esophagus. So if you have an issue where your provider thinks that you might have a swallowing problem as your main issue, they can do this test to see if your muscles in your esophagus are coordinated and are actually getting the food down in a coordinated manner into the stomach. So main point is that, like I mentioned before, heartburn, the feeling is not always associated with excessive amounts of acid or GERD. And I'll talk about GERD, which is just chronic acid reflux, but we'll talk about that in a minute. So why is this? It's because sometimes you can have pain, which is heartburn, the feeling of heartburn, without having an actual abnormal level of acid in your esophagus. The only way you would really know this for sure, of course, is to have the pH test done to track the amount of acid in your esophagus. And sometimes you can have reflux into your esophagus and not even know it's happening, a significant amount over time, and not know it's happening. So the pain and the issue of acid reflux in the esophagus are not always linked directly. So real quick, I want to just review what exactly is acid reflux. And that's just the stomach contents or juices coming up through that esophageal sphincter that's here, that's dividing the esophagus from the stomach. But for many reasons, you're having stomach acid come up into your esophagus. That's what the term acid reflux means. So let's talk about, like I said, they're not always related to acid reflux. You can have heartburn with normal amounts of acid. So everyone has some acid that refluxes up into their esophagus after they eat. This is a normal thing that happens. It doesn't happen for very long. It's very short-lived. You won't know it's happening. And also it usually happens during the day after you're eating, because that's when your stomach is actually going to make more acid to process the food. You would not feel heartburn. This is a normal thing that happens for everyone. There is a condition called reflux hypersensitivity, and that is, just like I mentioned before, you're having normal amounts of acid that are coming up into your esophagus, just small amounts that happen maybe after you eat or something. But for not completely understood reasons, you can actually feel that acid. So you feel heartburn, but if you had the test done where they check the pH level at the bottom of your esophagus, the result would say your esophagus isn't being exposed to more acid than usual. It's being exposed to normal amounts of acid. But for reasons that aren't completely understood, you can actually feel that. It's almost like a nervous system hypersensitivity. You can feel something that most people wouldn't feel. Additionally, there's a condition called functional heartburn, and that's, again, where you're having normal amounts of acid come into your esophagus, but you're experiencing pain. But if they did the test, you would report having pain at different times than the acid is actually refluxing up into your esophagus. So the main point, well, I'll go over this real quick. So essentially, these two issues, the reason I wanted to discuss them is that many people are just unaware that you can have normal amounts of acid refluxing into your esophagus and still experience heartburn. So if you did have a test and it said you had one of these issues, many times they will do a trial of pain mediator medications like nortriptyline, citalopram, or fluoxetine, and you might be familiar with these. Sometimes these are used for depression. Sometimes these are used for chronic pain. There are many uses for these medications. Also, sometimes you will do a low dose, generally, of an acid blocking medication or an acid reducing medication. And we'll go over those in a little bit too, to see if it works, because it's not completely the most well understood conditions, and you try to do something that's effective. One of the biggest indicators that you might be having one of these issues is you take antacids, but it doesn't seem to do anything with your heartburn. Now, that doesn't mean you have this issue, because it might just mean that you're not taking the medication properly, or you have some other issues happening. But one of the biggest indicators that this is happening is you get prescribed antacids and they're not actually taking care of your heartburn. You're still feeling heartburn. So again, main point is that not all heartburn means acid is refluxing up into your esophagus at abnormal levels. So now we're going to talk about the more common issue that is associated when people think of heartburn, which is when you are having more than usual acid coming from your stomach up into your esophagus. So if you have occasional heartburn and it happens after you eat a big meal, or maybe you had dinner and then you laid down for a nap 10 minutes later, or you had a food that was very spicy, or sometimes red sauce, sometimes red wine. If you had something like that happen and you developed heartburn, but you're not having any other concerning symptoms, and it's not happening that often, and you take an antacid such as like Tums or Mylanta or those kind of things, and it goes away, we would call that basically simple heartburn. That's something that most people will experience on occasion, and it's not necessarily an indicator that you need to see a healthcare provider. Again, this is only when you're having heartburn and it's very occasional, you're not having any other concerning symptoms, and it responds really well to taking an antacid. But when heartburn becomes something more concerning is when it's happening frequently. It's happening outside of right after when you eat. You might be having a lot of regurgitation of acid or food into your throat or the back of your mouth. That might cause you to have coughing, hoarseness. where your voice is getting raspy, and that is because your vocal cords are being exposed to acid that they're not used to. If you're waking up in the middle of the night, if you're having painful swallowing, which could be an indication, there's many things that could be, but you could have an ulcer. If you're having difficulty swallowing, sometimes when people have chronic acid coming up into their esophagus, it'll make the tissue more, less pliable, like less stretchable. And then you can develop strictures, which are little areas where the esophagus gets tight. And you might notice that you're trying to eat a piece of steak or something, and it doesn't seem like it's actually going down into your stomach, and you feel this sort of lump in your throat. So that's something that you would definitely need to have evaluated. You especially want to have it evaluated if you have risk factors for Barrett's, which I'll talk about in just one second, or if you have what's called alarm symptoms. And these are things that suggest that there might be something more serious going on than just a small amount of acid going up into your esophagus. So if you all of a sudden develop significant stomach pain, if you are having any sign of bleeding in either out of your mouth or out of your bottom, many times bleeding down below will be, you'll have black stools. That's what melena is, very, very dark stools. So if you ever have that, that's definitely a sign that you're having bleeding somewhere. So you need to have that checked out. If you're having iron deficiency anemia and not sure why, iron deficiency anemia most of the time is a sign that you're having bleeding somewhere. If you all of a sudden are having a lot of stomach pain or a lot of heartburn and your appetite completely goes away, you're losing weight, you're having difficulty swallowing or it hurts, or you're vomiting, that's when you definitely need to see a healthcare provider. And I'll come back to this in one second. This is what Barrett's esophagus is. So like I mentioned before, the cells in the stomach are used to dealing with a very acidic environment. The ones in the esophagus are not. So if you have a long period of time where that stomach acid is coming up into the esophagus, you'll get changes in how the cells in the esophagus look, and the cells will actually start changing because they're trying to deal with the amount of acid that's coming up and damaging them. This is a risk for developing esophageal cancer. It's still a very low risk, but that's something that you would want to have a GI physician monitoring. And these are the signs, are the risk factors for Barrett's esophagus. Being older, and that is mainly because you've had more time to have your esophagus exposed to those acids. Male sex, white race, a hiatal hernia, which I don't think I have a slide on that, but that is basically where a little bit of your stomach comes up above the diaphragm, which is the muscle that divides the chest from the abdomen. That just puts you at a higher risk of developing GERD and Barrett's esophagus. Obesity, if you're having a lot of reflux happen at night because there isn't food to neutralize the acid, if you smoke, or if you had a family member that had Barrett's esophagus. So any of those things, you definitely need to see a healthcare provider. So I wanted to review what GERD is, because that's something you'll probably, if you have significant heartburn and you're going to see a healthcare provider, you're going to probably hear this term called GERD. And it just stands for gastro, which is stomach, esophageal reflux disease. And it's basically just chronic reflux that's happening over and over again over a long period of time. Not everybody who has GERD will actually feel heartburn. So those people are will have, like, let's say that they, for some reason, ended up having an EGD, a scope down their throat, and their GI doctor says, oh, you have GERD. You have evidence that we have chronic acid coming up into your throat. And they never really experienced heartburn. But many people with GERD will feel heartburn because it's happening over time, over a long period of time. So how do you know if your heartburn is significant, if the amount you're having is something that needs to be checked out? Well, like I said before, if you're having any of those alarm symptoms, it's definitely significant. Or if you're having any of those alarm symptoms without heartburn, you still need to have that checked out. But by the medical literature, if you're having mild symptoms happening 2 or more days a week, or you're having severe symptoms happening at least 1 day a week, that is when you definitely want to go have this evaluated. So if you're the kind of person who's taking Mylanta or Tums with every meal, most meals, if you're waking up in the middle of the night, you definitely need to have that evaluated. I cannot recommend strongly enough finding some pathway to start keeping notes on when you're having the heartburn. And if you notice any food that is making it particularly bad, you can keep a notebook in your wallet or a little piece of paper in your wallet or in your purse. You can text yourself when you're having it. You can print out a little calendar and just jot down when it's happening and if there's anything that you notice is causing it. And maybe jot down as well how severe you feel like it is. Because sometimes it's difficult. People tend to remember bad things more readily than good things. That's kind of a psychological thing that we most of us have. So you may think you have very bad heartburn, and it turns out if you actually track it, it only happened once last week and then twice this week, and then you went a whole week and it didn't happen. Or you may not think you have heartburn that bad, and then you actually start tracking it and you realize you're having heartburn almost every other day and you're taking medication for it and you're still dealing with it and you're getting woken up. And so that's something that you need to have evaluated. So if you decide to see your healthcare provider, what you will likely experience is you're going to go in and they're going to ask you questions about how often you're having it, what the symptoms are, if you're having any other concerning symptoms. And that's why it's very good to have documented record of kind of what you're dealing with. And if they determine that your heartburn, you're definitely having it, but it doesn't seem like it's associated with significant problems and it's happening kind of at times that you would expect it to happen right after you eat, maybe if you lay down, they may have you do a trial of medications that suppress acid. So we'll talk about the 3 main types of medications. So the first type is just things you're probably very familiar with, like magnesium hydroxide, milk of magnesia, aluminum hydroxide, calcium carbonate, Tums, these kind of things. These are over the counter and you can take them after you eat and they neutralize the acid that's already in your stomach. Medications like Pepcid, Zantac, and Tagamet that you may have heard of before. These medications are in a class called H2 blockers, which you don't have to know that. But the way they work is they actually decrease the amount of acid that your stomach is making. So they're a little bit different than the ones that are neutralizing the acid that's already in there. The most common class of medications that you'll probably be prescribed, or well, most of these are the over-the-counter, but I think Protonix is still prescription, is what's called proton pump inhibitors. And these are like Prilosec, Prevacid, Nexium, Acifex, Protonix, this azole group. These medications also decrease the amount of acid that your stomach makes. And so it's very important to take them the correct way. These are the strongest medications that we have currently to decrease the amount of acid in your stomach. Additionally, if you see your provider, they may order some tests depending on what you're experiencing and what you tell them. So we'll review the testing a little bit more in depth. So the 3 main tests: EGD, scope down the throat; esophageal manometry, which is the one that says whether the muscles in your esophagus and whether the sphincter that goes between your esophagus is working properly; and then pH monitoring, which says how much acid is going into your throat. So first, EGD, like I mentioned, is the scope that goes down your esophagus into your stomach and into the first part of your small intestines. The benefit of this is the provider can directly visualize the tissue in your throat, in your stomach, and in the first part of your small intestines. They can see whether the tissue looks like it's had changes. They can take biopsies. They can see if you have ulcers and if you have any inflammation. And they can also put a pH probe down there, which I'll show you that in a second. The one negative of this test is it is invasive. You do have to take sedation. And just like you do with a colonoscopy, you have to go in and be sedated and get the test done. So it's a little bit invasive. If your provider thinks you might have an actual swallowing problem, the muscle problem of the throat, or a problem with the sphincter between the throat and the stomach, they may do this esophageal manometry test. And they put a tube down your nose and it monitors the contractions of the esophagus and the coordination of how the esophagus functions and the sphincter between the stomach and the esophagus. That's a little less commonly done. The third test would be pH testing. And there's a couple different ways that can be done depending on how your provider decides to do it. They can put a tube down your nose and it goes to the end of the esophagus, or when they're doing the scope down your throat, the EGD, they can place, there's a little they clip it into place. It's like a little probe that monitors the acid. In either case, they'll give you a device that you wear around your either arm or your waist or something. And you go home and you track, you push a button when you have food. You can see this one has a little fork and knife. And you also push a button when you're having symptoms. So when you come back and they read the test that gets recorded in here, they can tell whether the symptoms that you're having are happening when you have food, after you have food. They can basically tell whether those things are coordinated at all. So it's a very helpful test. And then they can also actually tell how acidic your esophagus is and know for sure whether you're having excessive acid come up into your throat or into your esophagus. So let's say that you have had some testing done or you've seen a provider and you are diagnosed with GERD, chronic reflux up into your esophagus. What can you actually do to improve that situation? The most important thing is to take the medication that you're prescribed, if you're prescribed medication, properly. The medication works in a very specific way to decrease, it affects the cells in the lining of your stomach. So it's not like these medications here are not like Tums where you develop heartburn and then you take the medication and it neutralizes some of the acid and maybe gives you a little bit of relief from the heartburn. These medications work more long-term on the cells of your stomach. So one of the primary reasons that people who are prescribed these medications or who are told to take them have failures and are still having heartburn is because they're not taking the medications properly. So most of the time, your provider will have you take it 30 minutes to an hour before you eat breakfast. And then if they have you take an evening dose, usually it's before dinner, but you should take it how your healthcare provider prescribes it, of course. But most importantly, if you're prescribed a medication, take it properly at the proper dose that you're prescribed or told to take it. Secondly, I know this seems to be the answer for every health issue, lose weight, because it kind of is. In the research, losing weight and elevating the head of your bed out of all of these things tended to be the most effective in the group that was studied. But you should try all of these things because for your particular situation, one of these interventions might actually work good for you, even though it didn't work good in the large population of people. So we'll go through each one of these and discuss why it's so important. So your stomach has a normal pressure with a normal weight person. Your stomach is under, or your abdomen has a normal pressure, and your chest cavity has a normal pressure. When you gain weight, that pressure increases. And you might notice this if you wear very tight clothes, if you bend over or somehow are pinched or something, you kind of feel more pressure in your abdomen and you actually are experiencing more pressure. So that sphincter that divides your esophagus from your stomach cannot stay shut against significant pressure. So if it's coming from being overweight or wearing tight clothes, you'll have some regurgitation or reflux of stomach acid up into the esophagus. It's much more likely to happen if there's higher pressures in the abdomen. That is why losing weight is so helpful in helping with GERD and heartburn associated with GERD. These are a couple products that I just saw listed. Raising the head of your bed works in a similar way, where it pushes the gastric contents down with gravity towards the bottom of your GI tract, and those gastric acids are not sitting up against the sphincter. So there's less likelihood that they're going to come up into your esophagus. So you want to raise the head of your bed at least 6 to 8 inches, and also avoid eating 2 to 3 hours before bed for a couple of reasons. When you eat, it stimulates your stomach to make more acid to take care of the food, to process the food. So you're basically telling your stomach to make more acid right before you're getting ready to lay down and have all that be right up against your sphincter between your stomach and your esophagus. And the food increases the pressure in your stomach and fills your stomach up, which again will make that sphincter more likely to have pressure against it. Okay, if you smoke, stop smoking. When you swallow over time, the saliva is actually sort of neutralizing. It's kind of going down your esophagus into your stomach, and it's sort of neutralizing and flushing your esophagus, so to speak. So when people smoke, they have decreased salivation. Smoking also increases stomach acid. It can damage the lining of the esophagus, making it more likely to be at risk if you do have some acid come up into your esophagus. It relaxes that sphincter, so again, making it more likely, and it slows how fast food is moving through your system. So those are all the reasons why smoking is bad for pretty much everything, but definitely for GERD. This is something that you would have to kind of monitor and figure out for yourself. I don't think the recommendation is to stop eating every single food that, makes life good or anything, but you need to figure out if coffee causes you specific issues, especially maybe if you drink coffee on an empty stomach. Maybe you can have a small cup of coffee with your breakfast, but maybe you get horrible heartburn if you have it by itself. Wine and alcohol can decrease the sphincter. It can actually make it more relaxed. Spicy foods, fatty foods, peppermint actually relaxes the sphincter as well. And then sometimes people have been noticed chocolate is a food that causes issues for them. But you have to figure out what food causes your issues. So in the similar manner that I was talking about with how nicotine and smoking in particular decreases your salivation, if you chew gum, like non-sugary gum, or suck on lozenges, that will increase salivation and that may help. So for instance, you might benefit from chewing some gum after you eat for 10 minutes, or having a lozenge after you eat to keep the salivation going to make everything go through and to kind of flush the esophagus. It's something that you can try and see if it helps you. So very briefly, I wanted to review a couple surgical options, just so you know that there are more aggressive things that can be done besides lifestyle changes and medication. If you are having, let's say that have a strong family history of Barrett's esophagus with cancer, you've been diagnosed with Barrett's yourself potentially, and it looks like it's progressing, and your provider wants to significantly decrease how much acid is coming up into your esophagus to protect you from developing cancer, they might do this procedure called a fundoplication. And it's essentially just taking the top part of the stomach and wrapping it around that sphincter to give it more support so that less acid comes up into your esophagus. It's a very simple way of putting it. There's a couple other things that I am actually not very familiar with, but I saw listed as treatments. There's a little magnet ring that, again, supports that sphincter. And when you swallow, the pressure from swallowing overcomes the magnetic pull. And so you're able to swallow, but as soon as the food bolus comes through, it tightens down again and helps prevent that acid from coming up into your stomach when you're not actively eating. And then there's also different devices that can deliver, like a balloon that delivers radio frequency ablation that tightens the tissue, helping again to support that sphincter to prevent the acid from coming up into your esophagus. Okay, so a summary of what you can do if you're having significant heartburn. Track your symptoms and your responses to any medications you take, whether it's antacids or whether you take one of the PPI medications like Prilosec, Nexium, those kind of things. You definitely want, if you're needing to take a medication like Nexium frequently, you need to be seen by a healthcare provider, because those medications, just like everything in life, do not come without side effects. Every choice, every action, there's always a side effect or a result that happens from that. So it's also important because you might be on medications that interact with these acid suppressive medications, and you might need to change when you're taking your other medications and those kind of things. So if you're needing to take medications frequently over time, you need to be seen by a healthcare provider to have that evaluated, because then they can make sure that you've been diagnosed properly and that you're not actually causing harm to some of your other medications or some of your other health conditions too. If you develop any alarm symptoms, definitely be seen. Take your medications as your provider tells you to. Even if they're over the counter, they will give you a prescription on how much they want you to take and when. Lose weight, elevate the head of your bed, avoid trigger foods, consider chewing gum, and of course, eat a healthy diet and exercise. It's worth it. If you have financial resources, spending those resources to improve your health is one of the best ways that you can spend your resources, because you're not able to do a lot in your life without your health. So if you need to hire a personal trainer, if you need to join a gym, if you need to have a food delivery service, those kind of things can revolutionize your health, and they're generally worth spending money on if you're able to do that. And remember that simple heartburn, where you just have it occasionally, it responds to antacids, and you're not having any other symptoms, is simple. But anything above that is happening frequently should definitely be evaluated. And I hope I've reviewed several issues that have convinced you that it can be kind of complex, and you need to have a healthcare provider to help you determine exactly what's going on with you and what the best treatment for you is. And that's it.
Perfect. Thank you, Melissa. It looks like we already have 2 questions in. So guys, if you have any questions, now is the time to put them in the Q&A in the chat. So the first question is, what causes congestion and burning sensation in my throat?
Well, if congestion and burning, so if you're having burning in your throat, most likely that is occurring because you're having acid come up into your throat. There are people that will have such severe acid reflux that will affect their vocal cords. They'll wake up in the middle of the night and they can actually taste a sour taste in the back of their throat. Congestion, I'm thinking maybe you're having mucus or something like that. I don't really think you would necessarily have mucus, but you might, that acid, and you might have some stomach contents coming up into your throat that you think is, you're kind of interpreting as congestion, but maybe it's some sort of, it's stomach contents coming up into your throat. So that's something you definitely get evaluated. And as far as treatment goes, besides being seen by a healthcare provider and getting the treatment that's recommended, definitely elevating the head of the bed would be a big thing to potentially help you with that, because you're actually using gravity to keep the stuff that's supposed to be in your stomach in your stomach.
Okay. Next question, can you comment on periodic episodes of heartburn that may be precipitated by stress or anxiety?
Well, so whenever I was talking about the reflux hypersensitivity and the functional heartburn, that is something, if you feel like you're not having any heartburn other than when you experience stress, it could be either, primarily two things is what I would consider. Number one, the stress is causing you to potentially eat less food, or maybe change your eating or drinking habits a little bit, and you're having more acid that I would say, we're going to use the word unopposed in your stomach. So one of the benefits of eating frequent small meals is every time you eat food, that's being mixed with your stomach contents, and it's making your stomach less acidic. So if you're sitting all day long for 14 hours or 12 hours and maybe just drinking coffee and not eating anything, you're going to have a very acidic environment in your stomach. And of course, that can come up into your esophagus. So if it's changing how you're eating, that could definitely result in a more acidic environment in your stomach, and then you'll have a feeling of heartburn. Or the other thing that could be occurring is when you're stressed, you're actually, your nervous system is sort of on high alert, and you might be feeling more, your brain might be interpreting symptoms that reflux or something that normally you wouldn't be paying attention to because your nervous system is kind of in a calm state. It might be interpreting symptoms as pain. So that's kind of one of those examples where you could go in, if you really wanted to know, you would have the tube down the nose and do the pH testing, where they actually track and tell you how much acid is in your throat. And you go home and wear it. And of course, ideally, you would want to have a stressful event so that you can determine whether, when you're having stress, the acid level in your esophagus is actually going up, or if it's still completely normal, but you're feeling heartburn. The other thing I would say, one more thing, is make sure that when you're feeling stress, if you say you're having heartburn, sometimes it can be tightness in your chest, sort of a chest pain thing. So make sure that your cardiac history is good and you're not having actual shortness of breath or chest pain. So it could just be tightness in your chest that you're feeling from the stress and you're interpreting as heartburn. But so those are the things I would think of. But
that's very good. No, I'm glad they asked that question, actually, because I think that's whenever I feel like I have heartburn the most.
Oh, really? Really?
So yeah, that was a good question. Okay, do we have any more questions? You know what? It doesn't look like it. If you guys come up with questions later, please feel free to reach out to me. You received some emails for confirmations, and my email address should be on that. Okay, Melissa, I think we're good.
Okay, well, thank you very much. I wish I could see the audience, but it's okay.
All right.
Hopefully,
well, thank you guys.
We'll be able to do these in person pretty soon. That would be nice.
That would be very, very nice. All right, guys. Well, thank you so much. You too. Bye.